Welcome again to Learning Pharmacology with me, Nurse Myron. For today's discussion, we will be learning about anti-anginal drugs. For our full disclosure, I am not affiliated with any of the manufacturers of the drugs or other items mentioned in this lecture. The mention of such brand names are only in passing and for educational purposes only, and are not for commercial promotion. I have no actual or potential conflict of interest in relation to this presentation. So let us begin with a brief review of the anatomy and physiology of the heart and circulation. The heart is the organ that serves as the pump to make blood circulate throughout the body. However, it also needs to be supplied with freshly oxygenated blood to keep working. Angina pectoris is chest pain or discomfort that occurs when myocardial oxygen demand exceeds supply due to reduced coronary blood flow, commonly caused by atherosclerosis or the narrowing of coronary arteries. It is a symptom of an underlying coronary artery disease or CAD. We have three types of angina. The first is your classic or stable angina, which is triggered by exertion or stress. Classic angina is caused by fixed atherosclerotic plaques that limit blood flow through the coronary circulation in the heart. Second, we have your variant angina, also known as Prinzmetal's angina. This is caused by coronary artery spasms and often occurs at rest. Last, we have your unstable angina. This is a medical emergency with pain at rest or increasing severity. It may indicate imminent myocardial infarction. The primary goal of anti-anginal therapy is to improve myocardial oxygen supply. Likewise, we also aim to decrease myocardial oxygen demand by allowing the heart to rest. In doing so, we aim to relieve chest pain and to prevent further angina attacks. All in all, the goal of anginal therapy is to improve patients' quality of life. So now we move to the different kinds of anti-anginal drugs. First, we have your nitrates. Nitrates remain as the first-line drug of choice as fast-acting vasodilators to treat angina. They contain nitric oxide that activates guanylate cyclase in vascular smooth muscle cells, increasing cyclic GMP, which leads to smooth muscle relaxation. These drugs dilate veins, which allows venous pooling to reduce preload. Likewise, arteries are also dilated to reduce afterload, thereby increasing oxygen blood flow to the heart. Coronary artery dilation improves oxygen delivery to ischemic myocardium. The net effect is a lowered myocardial oxygen demand with an increased supply. Nitrates come in several forms, the first of which is nitroglycerin. This is available as sublingual tablets, commonly as transdermal patches, and IV formulations. A newer form is in the oral spray, which can be easily administered to the patient. Next, we have your isosorbide dinitrate. To easily remember this, isosorbide dinitrate in oral form is known as Isordil, while the intravenous form is branded under the name Isoket. We also have isosorbide mononitrate under the brand name Imdur. These are available in oral and extended release forms. It is important for nurses to note that nitroglycerin and isosorbide dinitrate are used to immediately stop any anginal episode. Other anti-anginals are given as maintenance, including your isosorbide mononitrate. These are used to prevent further episodes of angina. Nitrates under this form are indicated for the acute relief and prevention of angina attacks, for the management of chronic stable angina, and sometimes for treatment of variant angina. However, hypersensitivity to nitrates, severe anemia, hypotension, or increased ICP are contraindications to nitrates. These drugs must also be used with caution with phosphodiesterase inhibitors, for example, sildenafil, because of the risk of severe hypotension. It is also noteworthy that pregnancy safety has not yet been fully established with nitrates. Side effects and possible adverse reactions of nitrates include headache, the most common side effect, dizziness, hypotension, reflex tachycardia, flushing, sweating, and palpitations. These effects must be noted by the nurse and reported immediately to the attending physician. Likewise, nurses should educate our patients to avoid swallowing the sublingual tablets whole. Instead, they should be carefully placed under the tongue and allowed to dissolve slowly. The correct administration of nitrates should be as follows. Nitrate sublingual tablets can be taken up to 3 doses with 5-minute intervals for chest pain. Close monitoring should be done in between. If after the third dose, chest pain persists or even worsens, emergency care should be sought immediately, and the patient should be brought to the nearest healthcare facility. In addition, blood pressure and heart rate should be monitored by the nurse. Reflex tachycardia is a possible side effect. As nitroglycerin also comes in patch forms, the nurse should note that patch sites should be rotated regularly. Patches that are currently on place on the patient's skin should be removed at bedtime to reduce tolerance. And they should also be removed before applying the new patch. Nitroglycerin should also be stored away from direct heat and light to maintain its potency. Patients should be informed about common side effects like headache and dizziness and how to easily manage them. Lastly, caution about safe posture changes should be ensured to ensure patient safety. Other drugs used as anti-anginals include your beta-adrenergic blockers and calcium channel blockers. For a more in-depth discussion, we have a separate recording under the title Antihypertensives. In administering anti-anginals, nurses should be aware of the following considerations. In assessment, nurses should closely monitor cardiovascular parameters, including the blood pressure, heart rate, and heart rhythm of the patient. This is done before and after administration. Usually, if the heart rate of the patient is lower than 60 beats per minute, the anti-anginal drug is not given. Nurses should also educate patients regarding the proper administration and potential effects of these drugs. Likewise, we should advise patients regarding lifestyle modifications, including proper diet, exercise, and enough sleep. Nurses should also monitor for any possible drug interactions, especially for nitrates with phosphodiesterase inhibitors, beta blockers, and other cardiac drugs. Nurses should emphasize adherence to the regimen even when symptoms improve. Remember that anginal management requires consistent therapy. Safety measures to prevent falls due to hypotension or dizziness should also be observed. Lastly, nurses should assess for side effects that require immediate attention, such as severe hypotension, palpitations, or allergic reactions. In summary, anti-anginal drugs play a crucial role in managing ischemic heart conditions by balancing myocardial oxygen supply and demand. Nitrates act mainly by vasodilation. Other drugs like your beta blockers reduce heart workload and oxygen consumption. Calcium channel blockers relax vascular smooth muscle and improve coronary blood flow. Understanding the mechanisms, side effects, and nursing care promotes safe and effective management of angina. Thank you very much for listening, and I hope you learned a lot. Continue enjoying learning.